Hi, I'm Dr. Nebel. I invite you to make coffee with me today. And I'll tell you a little about myself. I've been in medicine since 2003, been in family medicine, and then I did a geriatric fellowship in 2007. So since 2007, I have done exclusively geriatrics or senior care. I think I fell in love with that population because they didn't want fast food medicine. I loved my older patients because they were deep, thoughtful, and intentional, and I loved seeing them. They had needs that other people didn't necessarily see or take the time to understand. And I became more and more interested in that part of the demographic that actually didn't have a voice, that sensing what people need. That led me to dementia care because in later stages, those individuals aren't able to speak for themselves. And so they need someone who does just know or sense. That's how I fell in love with dementia care. That also led to, I think for some of the same reasons, just a sensing of end of life as well. From that came my interest in hospice. Now I'm not hospice or palliative med certified. I just do a lot of work in that area. A lot of that is sensing, especially when they're not able to express what might be wrong or have the insight or awareness, especially with our silent generation, into the non-physical factors that lead to pain and suffering. Got my death doula certification a few years ago to help speak to that need. I'll share more about myself as time goes on. Thanks for joining me for coffee.